and I adjust them, and I have a hello, and I discuss what the adjustment is every time. I try to relate it to organ function, every single adjustment, every time. Because they never what?
Get it.
They never get it. The minute you stop playing, stop playing to win, you're playing to what? I almost forgot, it's one of my favorite lines. You start playing to lose. You don't mean to play to lose, but you're playing to lose because you stop playing to what? You stop playing to win. Playing to win means every single time they're in there, you have to establish what? Purpose, mission, why, value. Every time they're there, you have to establish value. Bob, listen, it's Happy Healthy Frank Sinatra Thursday. Can't wait to get you checked. You adjust them. You tell them where you're adjusting them briefly, or at least what organ that's going to, and you say, man, that was a great adjustment. I can actually hear your pancreas working better. You hear it? Let's work on that next week. High five, get the hell out of here. That's how it works. I can actually hear you. How about the pregnant ladies? I can actually hear you and your baby getting healthier. That's the sound of getting healthy. That's what you say. Every time you give them some little something that says, listen, you're here for what? A purpose. There's value in what I do. You got to tell them every time. Because we didn't go to jail for what? To treat bad cases, man. Okay? Another great book, The Brain, The Last Frontier. Anybody seen this before? The adjustment, he didn't use the word adjustment, but the adjustment creates a shift in what?
Neural perception.
From survival and protection to, oh, look at that word. That is his word. What?
Transformation.
Right, 70, how many? 70 plus depend on,
Perception.
that come from the electrical and chemical signals of all the body and the information that goes into our, for perception begins with, they summate and to
Mental impulses.
poor quality of human. So listen, sometimes the subluxation, you've got to understand, your innate, your hardwired nervous system is trying to do everything correctly, right? But if it's only getting 90% of the data, the afferent, it's going to make the exact perfect decision and send the perfect message down based upon what it knows, what it perceives. But if it's not perceiving everything it's supposed to, the message, even though it's correct based upon what the brain heard, isn't the right message. And therefore it's going to cause distortion, dis-ease, leading to disease of the body. How long does it take? How long does it take your teeth to rot? I mean, you don't wake up in the morning and go, oh my God, I forgot to brush it. So the last time my teeth rotted out. Damn it. How long does it take? How about heart disease? I mean, you got to tell them this, right? Heart disease. How's heart disease work? Doc, I gotta be honest with you. I know I'm having a heart attack, but I was all good last night. I had a Krispy Kreme donut, a beer, and a cigar. I woke up this morning, everything's blood. Is that how it works? How long does it take to develop?
Long time.
I use that example. I want them to laugh because they're being what?
Ridiculous.
They're being ridiculous. You have to get them to realize in the nicest, kindest way that they're being what? Ridiculous. And once you get them to understand they're being ridiculous, you're going to open their mind a little bit to what? I need to be here. I should have been here. And my kids ought to be here so they don't end up like, okay? Is it rocket science?
Nope.
If our spinal joints are free to move with subtle grace and precision, our expression of our human is maximized. That is not a chiropractor. That is a neurologist writing that. Sounds a lot like a good chiropractor, doesn't he? As we move qualitatively and quantitatively, so we are. Stakes are everything, yes? See, when you just take the serum thiol level, I got 10 minutes. When you guys just take the serum thiol level, how powerful is that study? You remember what it was? We talked about it earlier? Did you guys forgot? Okay, which is what? DNA. So think about this. I'm a man. I'm in my what? Early
50
years. No, I'm pretending here for a minute. I'm in my earlier years. So, and I'm going to find a woman to mate with, no, just kidding. To have what?
Sex.
Children with, sex. And hopefully we're gonna have what, if we wanna have babies. See, the healthier my what? Sperm. Sperm, DNA is, and the healthier hers is, the healthier the baby is. Okay? So what lines have I affected right there? At least three. And then if I get mom to understand chiropractic care, lifetime wellness, I get dad to understand lifetime wellness care, the baby chances are goes up in a what? Chiropractic family. How much have I changed the world? Who knows? Exactly. But if you don't say it, and you don't open your mouth, and you don't take action, even if it's a little bit, what have you changed? You can't be neutral on a moving train. You got to stop pandering the message. They want it. They're dying to hear what you have to say. But we're so worried about them coming in on the next adjustment, we're going to lose a few bucks, or we don't want them to drop. Listen, go on eBay and buy a couple of babies. They're 12 bucks. They're not a real one. Borio chiropractic onesie. Okay? Get them printed so that when your practice members have babies, you send them a onesie with your name on it. How about this? When they bring their babies in, you take your stinking iPhone, you record it with one of your staff, and you make a DVD and you send it to them. How about that? How powerful is that? You put a little music on there, and it's the first baby adjustment. How important should it be? How important should that be?
Huge.
Huge. But if you don't make it important, they're not going to what?
Valuable.
If you just go in there and go, hey, yeah, they're going to go, hey, yeah, what'd they do? I don't know. He did this thing, he popped, and, you know, he said it was good to ever come in. I don't know. I mean, is that what you want them to say when they leave your practice? What should they say? You're trying to create what in your practice? You want to create warriors out of your patients. You realize when they leave their practice, how many bullets they take for you guys? You don't think they're being challenged by everybody? What are you still seeing Dr. Joe for? What are you still doing that for? Empower them with something so when they go out, hey, hold on a second. I know what you're saying. But you don't understand what chiropractic is. You don't understand the trauma that my child went through that birth canal and how important it was to get them adjusted. That's what you want them to say. But they'll only say that if you make it important. For no man can express through words or acts that which are not in harmony with their own beliefs. And if they choose to do so, they will fail with their ability to influence other people. If you don't own it, they're never gonna get it. They're never gonna get it. You practice within the 6 inches between your ears. You gotta get it. I'm still getting it. I read BJ and Dee Dee and Stevenson, I would say 3, 4, 5 times a week. Along with YouTube, I'm listening to Sigafus, Dr. Pete, I got him on my iPhone. I listen to everybody. It never stops. Because guess what? Not only do they never get it, guess who never fully gets it either? You don't. You don't dip yourself, you submerge yourself into the philosophy, the science, and the art of this profession. Why do I go over the history of our profession? Because I want you guys to be motivated by the dedication and sacrifice. Some of it was the ultimate sacrifice of the founding fathers of this profession. That's why. You should know what they went through so that you could get your license, and it wasn't to treat back pain.
Best friend gave me the best advice. He said each day